Well, man, this is awesome. So glad to have Ann on our show today. I'm the host, Michael Mann, and we are going to be really diving in all things cancer, cancer care, really those 167, whatever plus, maybe 157, because there's a lot of hours in the week of cancer treatment, all about what cancer looks like outside of those walls. And Ann, please, before we dive into a deeper conversation, introduce yourself.
Sure. And Stadjuhar, most recently, I have joined Reimagine Care in the long journey that I've had in digital health. I am one of those folks that has had a strange career in being able to start out in pharmaceutical sales and expanded to some really innovative organizations early on with both Health Grades and the advisory board company. And then has spent I ended up at Optum through the advisory board company and then spent the last 5 years of my career really working with digital health startups in go-to-market strategies, and working with them in remote care has certainly been a big part of what I've done in the past few years. Most recently, I helped found and essentially build some of the CancerX community, as well as, joining Reimagine because I was so inspired by some of the things that they were doing and feeling that it's these lightning in a bottle moments of right place, right time, and having AI backed by human touch being really the direction that healthcare is going to be going in the next couple of years.
Well, I'm really excited you're here. I feel like when it comes to cancer, everyone's been impacted by that. We're having so much rise, and you, I know you know a lot of this data. Before we get going, would you like to share a little more about CancerX? It just seems like such a great organization.
CancerX, was originally the Biden Moonshot Initiative. And I think that's always, the challenge now with the new administration, right? Anything Biden is essentially out, but that's not to say CancerX made a pivot in the last year to really be focused on some of these private partnerships, really being run out of a consortium of health systems that are focused on innovating inside of cancer and identifying new organizations through the accelerator that can truly impact cancer care. So innovation in general should be done in a community. I think sometimes that can definitely help to have some of those voices, and organizations like Moffitt Cancer Center and Atrium Advocate have been very good about really driving these initiatives and taking it upon themselves to sponsor innovation and sponsor these innovative companies.
Would you elaborate a little more in this collaboration, what that is in the community?
Yes, the community in and of itself has, a lot of different folks participating in it. But the health systems in and of themselves, through the accelerator, are ultimately identifying organizations that they want to pilot, they want to kick the tires on and work with. Last year, we had over 200 applicants to the CancerX Accelerator. It was whittled down to about 100. Then ultimately 16 organizations were, chosen by the investors and the health systems to go through a piloting phase or, a building awareness phase. At the end of it, several of them were able to actually get contracts with the health system, as well as some additional funding. So it's an accelerator that's working very much so hand in glove with the health systems to get things kind of underway, proven out. Even in the accelerator winners, not all of them will make it through entirely, but what we're finding is organizations, like Reimagine, had a lot of success in being able to get some additional funding, as well as being able to get contracts with the health system. And moving together as a group, it obviously speeds the adoption when the health systems are all kind of pushing each other and understanding more, and even talking behind the scenes about what's working and what's not working with some of these companies, and providing really candid feedback on what needs to happen to be able to make things go faster. I mean, I think the biggest struggle in all digital startups is the sales cycle
Mhm.
of taking so long to even get audience in
Yeah.
some instances. And if through a community you could do RFPs, if you could do if you had several health systems coming together to identify some of their top priorities, I think there's a big opportunity. I was a big proponent of community, both the Valid AI community as well as the Cancer X community. I do think that um, community can lead us into making better and faster decisions sometimes if they can all align on objectives and vote together on what we want to do first and move
I,
quick.
I just love how you describe what the community looks like. It seems like it's how is it developed, the planning cycle, how you have those committee, those advisors, the input. It seems like community done wrong can be worse than done right. But if it's the well spirited, and then that selection, oh my gosh, it's like the Top Gun, the best of the pilots, those startups that have that specific little thing that magic that they're working on. They know whatever it be from that, aspect of cancer or whatever stage or phase. It seems like I really appreciate your way you put color in that. Can you tell me, I'd love to know kind of where you came from Cancer X to now starting and, you've been on for a few months, what that looked like coming on to Reimagine.
For me, it was 5 years in consulting and working on multiple organizations and multiple projects and um, a lot of things all at once. And at this stage in my career, having gone through some lightning in a bottle moments again, both health grades, I had a tremendous run there with an IPO as well as some exiting, advisory board, the same thing. I think there's these moments in time where there are certain organizations that have an abundance of opportunity. And when I looked at Reimagine Care, I really was identifying that, like, hey, this company is somewhere where, I would want to be and be a part of, this all of the stars aligning with, AI, human touch and services. Quite honestly, having a moat around it that isn't going to die with Epic. And Epic essentially taking over, so many of the digitals. Like I'm looking at the digital scribe companies now, right?
Mhm.
Here's Epic coming along, and the millions of dollars that have been put into digital scribe, and it's like poof, it can essentially be devalued overnight just because Epic has a solution. And it's really important to have organizations that have some of that mode of service as well as technology and AI as well. So you essentially don't get eaten by the, Epic monster in your valuation downstream. So
So tell us a little more about that moat. Like, what is that strategic sauce about Care Reimagine that really made you feel at home or really like this is a place that I want to be at?
I think the fact it was backed by to people and oncology nurses and APPs in particular. It's not the patients essentially left out there alone. It's really an extension of what the hospital is doing, but simply doesn't have the resources to be able to do in some instances. And really maximizing on the operations around that, focused in cancer care. So the human component of this is probably the most important. I think that you saw a lot of VC, especially during the pandemic, go all in on technology. And they love the multiples on software, but software alone doesn't work. It requires so much change management and hands-on and workflow infrastructure that you have to have the service component involved with it, specifically in remote care. We saw there's RPM companies that sprouted up all over the place that were just software. And very few of the large organizations had the capacity or ability to service the means that were required from the CPT codes and the CMS to spend the 20 minutes of time inside of the patient charts and do, some of the things that were there. The hospital simply didn't have the bandwidth. Now that's grown and that's changed a little bit over the year, but with Reimagine, certainly cancer being a much harder condition to deal with in some instances, to be backed by oncology nurses, to be backed by those types of professionals is incredibly valuable. And it kind of is what struck me as the right recipe for really improving care at home.
So you have some really powerful metrics with the ED, readmission avoidance, lowering that. What's going on? What is happening right now that's driving that admission rate with cancer patients, and what is happening with Reimagine to kind of mitigate that?
Well, we do have Remy, and I think Remy is that AI companion to care that allows for the patient to get a lot of their questions answered in a very clinical pathway orientation. It's very specific to that treatment and being able to mitigate generalized symptoms and issues, but at the same time triaging the patient to be able to escalate it to the oncology nurse should it in fact need the human touch. Mm-hmm. And that's really some of the special sauce, is being able to manage almost more than 50% of our interactions with Remy, but escalating those patients if and when they do in fact need a nurse. And we're seamlessly able to integrate and be inside of the EMR. So all of the notes and everything are there for the doctors to understand what's going on with their patients. We're a natural extension of the hospital, white labeled under their, banner. And I think it's very easy to see where just the reality of having that someone to reach out to for a patient that's instantaneous can help a lot in cancer. There's no doubt that the patients often feel alone. They can be struggling with symptoms in the middle of the night. The fact that it's 24/7 is certainly something that, not every cancer care center can do. So our ability to manage those after hours, off hours, and save on the pajama time for the doctors and the burden on that staff is incredibly important, especially now with burnout.
Yeah, it seems like when you hear a little bit that I have, talking to patients or, that are in the system, it's not nothing against provider groups, but they don't, calling in at 8 o'clock on a Monday and waiting to be seen just doesn't work. And
Right.
I guess most oncology groups, they're still on that. They just don't have that set up.
It's, patients surviving in fear, too. The amount of stress I think that cancer patients are under is unbelievable. Their caregivers, their families, everything that is going on. And the ability to reach out to someone or something to just help understand how you're feeling and your symptoms is incredibly important. The other thing that obviously comes into it is scarcity and financial. The financial toxicity in cancer is absolutely obscene when you look at almost 50% of people in cancer care treatment filing bankruptcy. 3 out of 4 people are entirely financially impacted. You're talking about, treatments that are $40,000 a month in some instances. And identifying needs and rides and food and awareness and social services for patients is incredibly important as well. I think one of the things that we see with Remy is the ability for patients to often interact with the robot or and they're more willing to sometimes say these things to, a robot or essentially the AI versus a human, because it can be embarrassing, it can be difficult, it can be tough, and the ask for help with the bot may be a little bit different, and where it can get escalated, where it can get even triaged to the right person to be able to help them is important too.
When I hear this, I feel like it's social care, which would be, very much needed for caregiver support with aging loved ones, behavioral health. Is REMI, is it across the board for other platforms? Are they in other? It just seems like the way healthcare should be in a perfect setting, whether you have cancer, you're just needing a lot of care and help and decision support.
Yes. And, cancer, of course, being probably one of the most complex conditions and the most financially impactful, undoubtedly across the board. I think people would benefit. I think we've seen some new legislation and CPT codes even around SDOH. The PIN codes are out there to be able to collect the data and the information. I will say the reimbursement is somewhat menial on it, but it is good that it's at least being recognized. It is interesting to think that perhaps the agents and the AI companions will be better at collecting this data and the truth inside of this data than a human, just because of a comfort or an embarrassment. That goes to end of life conversations too, right? They've seen that ultimately sometimes proven out, where people feel comfortable discussing finances or mortality. Sometimes the guard comes off when you can just be frank and honest with something that maybe isn't as human and might not be judging you. And I think that's a fear in some instances, and people even disclosing this type of information.
So what about the payer, like with value-based, like the reimbursement? How did you want to talk a little bit about that? Because I'm sure there's probably no reimagined care if you can't figure out how to help the ROI or the bottom line or whatever you want to use. Do you want to discuss a little bit of that?
Sure. It's interesting, in this last year in 2025, we had some PCM codes that came out in the legislation that were specific to really cancer care. And those certainly help. I think at the same time, there's so much more CMS could be doing from the standpoint of legislating or providing some of these opportunities. But cancer care is certainly one of the last bastions. From the health plan side, the health plan is really struggling, because of the enormous costs that are associated with cancer care treatment, largely due to the cost of the treatments and the drugs themselves. So, we're seeing some challenges there. But one of the most important things that I look at with the plan is like site of care. And the reality that site of care can be 300% more in some instances from one location to the next. And, why not have better opportunities for care at home and less expensive sites of care? But, it's this struggle between the provider that is like looking for the best reimbursement that they can get in some instances. And affiliating with that. And I speak from my own personal story of having cancer myself, as well as my gyn-onc who left HCA because he couldn't do infusions in his own practice. And, he was like, I'm tired of this. This is ridiculous. I can do it much cheaper. My patients are much more comfortable, but HCA makes a lot more money when in fact the infusions and everything are done at their facility, because their negotiated rate on that side of care is 200 times more than what mine is. And that's disturbing, that there's some of that. And so how do we close some of these gaps and some of these loopholes? Everybody identifies them and finds them to maximize certainly on some of the reimbursement rate. But, I think there's plenty of opportunity out there to reduce the total cost of care as it relates to cancer. But at the same time, a lot of it lies in the treatments themselves too, and the cost. And as we move into more precision medicine and what that looks like per patient, it gets very difficult and intriguing as to what the treatment looks like if we're in fact getting even down to that individual personalized level. And can the health plan even get there?
So how do you balance this as a business? Like, obviously, healthcare is so complicated, right? You have multiple stakeholders. You have the patient, of course. the providers, the payers, pharma. So how does Reimagine, I know you're fairly new, but how do you delicately balance that to get that right?
I think that, we've played our foot in both canoes in some instance of fee for service and value-based care. I think any organization a little bit is trying to balance the reality that there is the fee for service world. There are those realities and priorities that can be met. When I look at CPT codes in general, though, I don't see that as being anything that is not value-based care, right? CMS has devised these codes and they've done studies and they've worked on it. And the fact is that oftentimes that fee-for-service component is very much so there because it's studied and, from an impact perspective, there's a reality on that reimbursement. On the value-based care side, it's incredibly difficult. You would think in cancer care that reducing emergency room visits and readmits is, of course, incredibly important for the patient. It's important for the burden on some of the providers. But the reality is the health systems are not penalized for readmits in cancer. They are in several other, disease states and chronic diseases, but there's just not that reality in cancer care. So how do you tell that value-based story? And I think some of it is, in fact, who your client and your customer is. At Reimagine, we've chosen to call on providers, and providers are our primary source of business and who we call on. Had we gone to health plans or an employer, it would have been a little bit different. But, I still believe that at the end of the day, everything falls into the lap of the provider anyway. Half the time, the employer benefits are never even aware or relayed to the physician. They certainly don't know, let alone, the plan and keeping track of all the different plans that their patient may have to identify what benefits, in fact, may be appropriate. It's very convoluted, but can you go and you provide a service to the provider that's overall beneficial? I think is important, and that's where we start.
I like how you clarify that. And I imagine the providers are under a lot of pressure. I imagine there's enough marketplace, as much as there is no free market entirely anywhere, especially in healthcare. It's mixed. But is there enough competition amongst providers and reputation that I can only imagine there's a demand and a frustration with every patient journey that family caregiver to deliver. Just what you would think, you order an Amazon package, you click, you get to someone, and walk through us that little minds, kind of, I don't know what the design, just sort of that mindset, if you would, that has helped the providers saying yes to you.
I think it's the reality of the physician burnout and the provider burnout and capacity that is simply not there to be able to, truly handhold all of the patients through all of their symptoms and the difficulty of treatment in cancer care. And they very clearly understand when we say that we can help alleviate, a lot of that burden, help triage those patients, that it's a very good idea to be able to use some tools like REMI and Reimagine Care. I think at the same time, there are some billing opportunities that have become new. Like I had mentioned earlier, the principal care management codes, the PIN codes, there's, remote therapeutic monitoring. There are some fee-for-service realities that can be captured that the health systems simply don't have the bandwidth or the opportunity to capture. And, I think it's our ability to assist with some of that too that can be beneficial. So again, playing in both the value-based care and the fee-for-service world on this, there is a blend of what we can do at Reimagine Care to kind of maximize on some of those revenue opportunities for the hospital.
Well, Ann, I really appreciate you coming on. What else do we need to be talking about right now? I mean, you are an SME, expert on cancer from multiple levels, and I'm so glad you're here and helping us better understand what we're up against and how to make cancer care in the home better.
I think the data and the reality of all of this data that we've been collecting to help establish and build AI models that are better are the only thing that's going to kind of save us from the silver tsunami and the reality of everybody aging into needing care, not having enough caregivers. And the sooner that folks can embrace some of the AI as well as get it regulated, is going to be incredibly important. It's one thing for the digital scribe companies to be out there and certainly, gathering all of this data and able to get it into the EHRs. But now it's that question of what are we doing with all of this data to get smarter, move faster. And we're in a really, really interesting time right now. I can't even imagine in the next 2 to 3 years what it's going to look like. Just given where we came in the past couple years with ChatGPT, and some of these new AI models. And I think it's important to be aware and open to them, but at the same time, this notion of being human backed is very important. AI is truly there to, enhance the human ability to ultimately control and make some of those decisions, and remove some of the friction that's always existed in the data itself. So we'll see. I mean, we are in interesting times with this administration too, and even in the past couple of weeks, his view, Trump's view on digital health and some of the opportunities that exist. We'll see what happens. But I think eyes on legislation, eyes on what's happening on the Hill. And, are we really in the Wild West of AI opportunity? And how quickly will some of it be regulated? I like to look to Europe a lot. They seem to be ahead of us in a lot of things, whether it's, blockchain and even some of the financial side of the reality or in AI regulatory oversight.
Well, coming back to what you can control with reimagined care, there's so much data you're gathering for patient. Are you guys got other business models like building out protocols, licensing? Obviously you don't want to get too much into that, but just sort of give us a little texture on what that could look like over the next year.
Really, right now we're focused on making our models and REMI, I think, as efficient and working as effectively as possible, as well as that escalation and triage to that human touch. So how we can make our people smarter, who are in fact handling these calls as they escalate, is incredibly important. Downstream, as we continue to figure out some of our path, we will look to more and more care being pushed to the home. When Reimagine first started, the goal was having chemo in the home and CAR T and some of the treatments in the home. I think at the time, it just wasn't quite there yet and we weren't ready. And so I could actually see some circling back to the original origins of some of where Reimagined Care was in being able to do more treatment in the home. And again, that site of care, total cost of care reality being incredibly important, and wondering, if in fact we can reduce that by having these patients more comfortable at home being treated, and where does Reimagine sit in that, and what does that look like? I think we'll eventually be growing to be able to support that.
Would you like to share a little more about your hope? You're still new. You're excited. You're tasked with a lot. Would you share more?
Having gone into several organizations as the chief growth officer, or at least in a consulting capacity to help with go-to-markets and kind of reinvigorating where they're sitting in the market. I think that Reimagine, again, is sitting on this precipice. I think it's looking back on what the organization has been doing, and really fine-tuning it and getting very specific on where the most opportunity is, what we are actually doing. Is there, some reimbursement, or is there a better way to position ourselves? These are, some of the things that I'm looking at right now is, how can we maximize on what we've been doing so well and really tell that story better, improve upon it, and help more patients and help more health systems and facilities take advantage of these opportunities that we're providing.
Well, I'm really glad we were able to connect today and learn more. I think what I'm curious about is a little more about that home, the care in the home. If you'd like to just share that journey, I think if there's a little bit that you could say what that experience looks like with reimagined care a little bit.
Certainly. I mean, I think, it's some awareness of where this has gone, even again, watching legislation. And legislation is incredibly important. I mean, I spend time at the advisory board too, right? That was so much of what they were focused on. And the reality is the codes, the legislation ultimately creates some of the, metamorphosis that needs to happen with site of care. And we saw it start with RPM. We moved to hospital at home. The majority of the health systems have really not been able to get beyond like 50 beds for hospital at home. There seems to be this threshold, and how do we break, down that barrier for some of these hospitals to be able to get there? You even see it with organizations like Best Buy. I think Best Buy has been very interesting, right? You saw Current Health and the Current Health acquisition. Now you see Current Health spinning back out of Best Buy. Ultimately, their goal is to go into some of the CAR T space as well. And, looking at what and, why, I think it's the cost of care and knowing that they can reduce that cost of care and that cost of treatment for patients. And it's where you can have the most impact. I think at Reimagine, we're talking to a lot of different partners that go into the home. We work with Dispatch. We've aligned with even some conversations with Current Health. It's putting the treatment at home, and then where we can support it with our bots and Remy and the oncology nurses. Now, there are organizations that specifically go into the home. We're not one of them yet, but that's not to say who knows what happens in the future, what type of partnerships we devise that we can help support with. I think that's still to be determined and fine-tuned, but I do think care at home is going to continue to evolve heavily. I've worked historically, even like the Samsung deal with Zelf and what they're looking at. And it's very much so like, how do we get more treatment at home and more connectivity at home for the patient? Because it's where they want to be in treatment, and it also reduces cost of care.
And not to, I mean, with what you're doing, you are providing a platform, a way for those who are under the care, with their cancer treatment using your platform. So, I mean, it is by default, it is in the home outside of those walls of the clinic.
Correct. And, that ability to text with Remy, to text with the staff and the nursing, or have a phone call and a visit. That's a lot about what it is how much we can support those patients so they don't have to go into the facility, as long as it's not to be poked or treated. In a lot of cases, a lot of those conversations and everything can certainly be managed at home. So if we can do that, and you can even not get in your car and have to drive and navigate a large, health system building and parking lot, the better off the patients are.
Yeah, I think what you were describing earlier with the Best Buy and Dispatch. I also think of all the home cares, but it's so hard, in healthcare, the client acquisition for home care, the cost of those really very trusted referral models make it really difficult. So I imagine as a chief growth officer, you are you're utilizing all those data points and one by one trying to figure that out. And would you like to just share a little bit about that as we kind of come to the end?
Sure. I think it's very important for a lot of these organizations to actually be perceived as an extension of the hospital, and being able to understand their protocols, In fact, being almost badged right under the hospital and all of their requirements. That's one of the things that we do at Reimagine is, make sure that all of our employees are fully aware of the health system itself's protocol. So it is seen as a white label and, that extension of the hospital. I think the mistake sometimes is organizations really wanting to build their own brand entirely. Like, oh, Best Buy, yes, it has a very big brand. Does it have a brand that's totally recognized in healthcare? Maybe not.
Mhm.
And where are you with these employees, that are going into the home? Is it better to just badge and train them and really make them an extension of the larger entity? I think that's what's important, and being able to study that organization, its workflows, its processes. That's what we do. It's that hand in glove scenario too, where we truly try to be an extension of the hospital. So the patient is not necessarily feeling like we're just another entire entity or somehow disconnected. That's not the way it is at all. We're in the EHR. We're working with their clinicians and their physicians, and that connectivity and integration, I think, is really what's important for companies.
Yeah, I think especially in healthcare, there's so many, one more referral, one more organization, that it overloads the patient. So I think that seamless white glove, or excuse me, white, not just the white glove, but also the white labeled, where it's not even, you guys are seamlessly embedded in the organization for the patient experience, is critical.
That's why we go to provider first. I think
Mhm.
even you look at a time care, or you look at the others that come from the plan or from the employer, that is potentially seen as like it's disconnected.
Mhm.
Right? They're not in the EHR. They're not, able to do some of that. Now you're seeing them back into, like, we need to get into provider, I think, is part of some of their initiatives. But we started there, and I think that's the best place to start. I've always worked really more heavily with the providers, even though I worked at plan. I understand plan, having been at Optum and UHG for a few years, and my heart's with the provider, to be quite honest, in all of this, and as close as you can be to the patient and their treatment.
As we wrap up, where would you like to see cancer care in the next 5 years? If Reimagine Care could really realize and reimagine where care is in 5-7 years, where would we be?
I think, personalized, very personalized care, truly understanding the ecosystem, the culture, and the environment that people are living in so they can get better treatment. You can even, and I think AI will allow us to um, understand people differently and be, we've talked about it for years, and it happens in banking and it happens in commercial scenarios where they know so much about us. They're able to really personalize our messages, what's in our feeds and everything like that, in order to really speak to us. And I don't think healthcare is there yet, and it certainly doesn't do it. I was laughing this morning. I got a letter from UHG that was like, hey, avoid emergency room visits, and this is what you can do. And I'm like, do you know who I am? No, you don't, because if you did, you'd never even send me this envelope and mail it to me. And it's a waste to do it, for someone like me. So I think we can take out a lot of cost of care and a lot of some of the education if we truly understand the patient and who needs to be educated, who needs to be talked to in a certain level or voice to understand. That customization is going to go a long way, and it's hopefully what so many organizations are learning by collecting more data, but identifying too the problems and the social constructs and the things about people that are going to help them along in their treatment and help them understand, what's going on.
Well, Ann, I'm going to share a personal thing. I play pickleball. I try to work out. I try to engage in my own health. I think it's critical that we do that. I'm trying to be better as a family member and all those other things too, on a personal, what is something I think as healthcare leaders and people in our healthcare, we need to take some sort of sovereignty, ownership in that. Tell me something that you could share with our audience that you think is instrumental, regardless of whether you're a cancer survivor or however it be, that's a positive influence on your health as you go each day.
I mean, for me personally, it is the ability to manage my own healthcare through now more of the consumer models that are out there. This last year, for my big birthday, I decided to use Function and go out and get Grail and the cancer testing done. It's not inexpensive at $800 a pop, but nonetheless, being able to do all of my blood work, get my labs back, identify some of this, take control, like you said, of some of my care, I think is incredibly liberating. The other thing is like, hopefully we get to the place where we release the data and I have my own health record and it's portability in my own health record so that I can go see different doctors. I can tie in all of my Function blood work with, somebody else who might be managing my care. I can do that and create the best ecosystem for me personally that I want. But there's a lot of opportunity out there now with some of the consumer things that are available. I think the GLP-1 certainly kind of broke that fourth wall, but now let's liberate the data and let me have my health record.
I love that. I have one quick gotcha question. Are you familiar with bioidentical hormone treatment? Are you hearing about that?
Oh no, I'm on it.
Oh, okay. Okay.
Yeah.
But that was a fight. How did you find out about that?
Oh, I mean, for me, it was funny when I say I was in pharmaceutical sales from the beginning. I launched NuvaRing and Mirena, and I've always been in women's health. And some of my best friends are OBGYNs, and the literature and the studies and my own brain fog and my own struggles with everything that was going on. I thought I had long COVID. It was like, what is wrong with me? But it's like now, finally, I think you're seeing a big focus. There was a big investment, I think, too, in women's health, even with some of the VCs over the last year. But, being able to debunk, I think, some bad studies from the past, as well as, get some more treatment out there. I think my biggest frustration is like, why is this not covered? In some instances, hormone replacement therapy has still not reached, I think, the planned level of coverage for women. And, I look at men in testosterone clinics that are like 7-Elevens on the street corner. And, some of these compounding pharmacies and women, I think, just haven't been taken care of like that. And it's unfortunate, but there's a lot of opportunity there. And, my awareness of it is certainly from my personal edification, friends, and being of a certain age.
Yeah, well, I'm there with you. My spouse, has benefited just recently, and it was from a story she found others that had done, and it's and it's not standard of care and treatment. There's still a lot of nothing against doctors. This isn't bashing healthcare, but it's really frustration on that journey. And, I'm really, I guess, inspired that you are, sharing your own healthcare journey, how important it is, because this is really what this show's about as well, to empower and equip us to be, better, as we try to age, healthily as best as we can. So I really appreciate your, sharing your own experience. And anything else that you'd like as we wrap up, having you be here today?
No, I mean, I'm just really excited for to start this new journey with Reimagine Care. And, I think it's keeping an eye out for what we're going to be doing next. And, Dan, who is the CEO of the organization, is certainly out there, and we're on several panels and things like that coming up in the fall. Hopefully we continue to get the message out about how important this is and what a great solution we have at Reimagine for patients and providers.
Awesome. Well, this has been great having you on, and appreciate it. And you have a great day.
All right. Thanks so much, Michael.